Therapies.
Start over.
Hi guys, welcome to Optimal Physical Therapy's first golf tip of the week. We've been working on putting this together for you guys using and having it all derived from the Gray Institute Functional Golf System. And we're going to be using Jared and our other clinicians here, Dr. Jen and Tiffany, to demo some of the things that will help you to improve your swing as well as help with some of the mechanics. So what we'll start with today is talking about some of the zones of the golf swing, which we refer to as transitional or transformational, thank you, zones. And in the backswing is one of those transformational zones where we need to use mobility, stability to change power. And we'll be talking about the hips and the mid-back today and how mobility in those two body regions are really important for having a solid golf swing. So we'll have our models here start by looking at the backswing, or the backswing transformational zone. And for the hips, what's required is a lot of internal rotation, and this is something that we see with our patients, that they lack this motion. So internal rotation is when there's a turning in of the hip on the pelvis. And what Dr. Jared will show you here is in that backswing transformational zone, you can see how his thigh bone here stays relatively straight, but his pelvis turns towards it, and that's internal rotation of the right hip in the backswing transformational zone. So if you're lacking mobility here, this can really be something that limits your ability to generate power from the glutes and generate power to deliver at the golf ball. Now, conversely, in the follow-through, which is the follow-through transformational zone, you need that internal rotation on the left leg. So you see that the left thigh bone stays relatively straight while the pelvis comes over the top of it. So what do we do about this then, and what should a warm-up look like on the tee box? We've all seen people do some pretty wacky things on a golf tee box to warm up. And one of the big things that we've learned through going through the specialty training program is that your warm-up should really look and feel like golf. So one of the warm-ups that we'd like to show you guys today is emphasizing that internal rotation in those transformational zones. So they'll show you what that looks like here today with a on the tee warm-up that you can do to help emphasize rotation of the hip. So what they're doing here is stepping ahead and across their rear foot to help with emphasizing the internal rotation of the right hip. So this is going to help to improve the mobility there, but also get you ready to generate more mobility and stability above that right foot when you're in the backswing transformational zone. Now, for follow-through transformational zone, it's very similar in that when you can go through what looks and feels like a golf swing, as we said, and step through to get to emphasize that internal rotation about the left foot in the follow-through phase. Now, you can do this slowly as they are here, and you can also speed this motion up a little bit, like how the golf swing is, which is a quick movement. Now, the other thing we'd like to talk about today is the thoracic spine, or the mid-back, and the motions that are required to deliver a good golf swing and improve your power there. And one of those motions is extension of the back, or this leaning back motion of the mid-back, paired with side bending in the golf swing. So if we have Dr. Jared and our models here turn around, you'll be able to see, or yeah, why don't we face away from the camera, they'll be able to see some of that extension there. So as you come into the backswing, and we get into that backswing transformational zone there, you see that the back has to straighten or extend more and also be tilted to the side. And as we come from the backswing transformational zone into the impact zone, and then through the follow-through, then we also have to have extension and side bending to the opposite direction. Very nice. So one of the things that we see are patients in the desk posture position, and they get kind of stuck there, or it's called a kyphotic back position. And so getting into more extension can help with generating power and getting through those zones. So one of the drills that can help you on the first tee box to help with that mobility is doing actually essentially what we did, but having your hands up. So you can drop the club, and if you put your hands up in the air and go through those same drills with the hips, but now trying to stick your chest kind of up in the air, working on that extension and rotation. So extend, rotate, side bend. You may feel a stretch through your mid-back with that as well. Now, the nice thing with this is these drills will feel and look a little bit more like your golf swing. They should help with improving mobility and power. And we'll have another golf tip of the week coming for you next week. Also keep an eye out for a Facebook live stream on foam rolling, which will touch on working on that thoracic spine mobility or that mid-back mobility. And as Ben Hogan said, remember, the most important golf shot is the next one. Thanks guys, we'll see you next week.